Welcome back to episode 63 of Your Birth Bestie podcast. Thank you so much for tuning in today to chat about natural methods to start labor and really to prepare your body for the laboring process. And I have to start by prefacing with the fact that I strongly feel that you do not have to do absolutely anything to force your labor along. If you maybe are higher risk and have chosen an induction for medical reasons, but are maybe trying to avoid that from happening, this is a totally different situation that maybe you'd be more aggressive at doing these things. But either way, not to the point where you are stressing over this checklist of things that is hopefully maybe going to kickstart your labor. I will share some ideas to help you get labor started if you want to try them, but I think reducing your stress levels and focusing on confidence and comfortability, manifesting the best possible birth outcome is the most important thing. When you are feeling safe and calm, your oxytocin levels are going to flow so much better than if you are in that fight or flight mode, really stressing to try to get your body into labor and to move things along. This calmness and confidence comes with preparation and a really good birth support team that you can lean on. And because I'm so passionate about birth education and trusting your body and trusting birth, I want to give anyone who is listening to this episode a special discount code to my online birth course, Fearless Birth Academy. It is a comprehensive 11-module birth course rooted in informed decision-making, birth autonomy, and mindset, and has been crucial for so many moms to feel ready for their birth. So if you're interested, you can use the link in the show notes or the promo code TRUSTBIRTH, which is one word, at checkout to dive into the Fearless Birth Academy for only $1 due today with 2 additional monthly payments of $49 on the payment plan option, or you can pay in full for only $99. I will be making changes and adding more resources really soon that will be making the course more than double the price that it is now. So this would be a really good chance to grab it if you are interested in preparing for your birth. Hey there, I'm Beth Connors, a midwife and mom of 2, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. So I don't know if you can relate to this feeling or have seen it before too, but in the last several months, I have seen so many posts in the Facebook mom and pregnancy groups that I'm part of about cervical checks being discouraging for moms and just in general trying to rush labor along naturally or scheduling their inductions, things like that. I wish I could personally talk to each and every one of these moms, and I probably do overshare in some of my comments about the possibility of birth happening without a single cervical check or about waiting for labor to naturally happen on its own. And the possibility of birth happening without a single cervical exam does blow many people's minds because that's just not the norm. Here is an example, though, of one of the many messages that I have responded to, and I will read it here. I am 36 and 3, and my doctor checked my cervix, and it's still closed and not effaced at all. I know I'm only 36 weeks, so there's still time for it to change and for my body to do what it needs to do when the time is right. It's just a little bit discouraging. I'm really hoping I don't need an induction. She said 41 weeks is the furthest she'll let me go, and at that point, she will schedule an induction. And when I read this, I saw so many red flags that are examples of how women are being conditioned to think about birth. First, a cervical check at 36 weeks is unnecessary. Unless you've scheduled an induction at that exact moment on that day for medical reasons, why are we even checking mom's cervixes at 36 weeks? That's usually the appointment as well for the GBS swab that's collected routinely, but also something that you should receive informed consent about. And I have another episode about the GBS swab and what that means and how to treat it. If you want to treat it, all the options for that in another episode. So I will link that in the show notes. And it's often very common for providers to do the swab and then follow that up with a cervical check right after. Some moms are given a heads up. I've heard of some that haven't. So please speak up to your provider and ask questions to know what the plan is during that visit so you are not blindsided in the moment. This mom also says it's still closed and not effaced at all. And most cervixes are at this point because not even being 37 weeks or full term, your cervix is staying closed to protect your baby. This makes it sound like she was expecting progress already 4 to 6 weeks before she was even expected to have her baby, which, isn't usually the case to be dilated before 37 weeks. And you really don't want to be, right? She then addresses that there is still time for it to change and for her body to do what it needs to do. But then she says, it's a little discouraging and I hope I don't need an induction. Women should be gearing up for an amazing birth and being instilled with confidence and hope for the best birth experience. So why are women feeling discouraged and already thinking about needing an induction at 36 weeks in a normal, healthy, low-risk pregnancy? This is often due to the lack of education at prenatal visits and also the way in which many providers communicate things to their patients. I often hear providers say things like, you're only, X amount of centimeters, or you're not at all effaced yet, or even talking about inductions and scheduling one just in case. This is something that drives me a little bit crazy because the second that you put those thoughts in a patient's head, they can't help but prepare for that new experience, and their focus completely shifts from having an amazing birth in the way that hopefully they have already started to plan and maybe are trying to avoid an induction, and focus their energy on the natural ways to induce from a place of fear and anticipation of avoiding that, which probably doesn't help labor start in itself when all those things are coming from a place of fear and rushing things along and feeling like they have kind of an expiration date on the pregnancy. And then the last thing about that statement was a provider telling her that she said 41 weeks is the furthest she'll let me go, and then she will schedule an induction. To me, this sounds like the provider taking control of the situation and really doing what they want to do and only giving them one option, which is their opinion, versus giving them the information to make their own decision and kind of telling them the pros and the cons of each and making a plan together and continuing to have the mom be at the center of her care, which is so, so important. Instead, moms are being put on the clock in labor right from the time that you get into the hospital, and often labor is forced along if certain progress isn't made, or the time that your water breaks is documented, and strict guidelines are often followed to get things moving within just a few hours. But now it's like women are on the clock even much earlier than that in pregnancy, and they're having these conversations that maybe can be, more appropriate to have at a later time when things actually were to happen. But in a low risk pregnancy, it's often very safe to continue waiting and not trying to rush things along. And in a side note, I did share in a previous episode how I went in for my initial prenatal visit with my second baby after having a 10-pound, 12-ounce first big baby. And from that very first appointment, they said my baby should be born at 38 weeks due to how big my first was. That was honestly the highlight of the appointment, the most that they focused on. And I was instantly discouraged that this pregnancy was just not going to be how I wanted it to be. I was maybe 10 weeks at the time and already bombarded for an extra diabetes screen at that appointment super early on in pregnancy. Told I would need growth ultrasounds near the end of my pregnancy, was told I needed to start chiropractic care at 30 weeks to get things progressing and ready to deliver early. Just all of the things rushing me along and putting all these thoughts and to-do lists in my head, even for my first trimester. But let's now get into some of the types of things that you can try or the natural methods to encourage labor if maybe you are well past your guest date and feel like you need to do something because otherwise you're going crazy and you're just waiting for your baby and you feel like you want to maybe move things along. You're trying to avoid a medically necessary induction, or you are helping prepare your body for labor. But the key is stress and fear cannot be part of any of these treatments or part of the equation at all, because that block will likely stop labor from happening or not make these natural options as effective. So here's my list of all the things that you can try to naturally prepare your body for labor and potentially encourage things along, even though, remember, I said you absolutely do not have to. Trust birth first, but do these things if you feel it's right for you and they are appropriate and approved by your birth team. So the first thing would be staying active throughout your pregnancy, including walking, curb walking to help your baby move into your pelvis and prepare for birth, gentle stretches, prenatal yoga, or strengthening exercises of your hips, glutes, inner thighs, and your back. Some of the professionals that can help with optimal body functioning. They can reduce pain and help you enjoy your pregnancy more when you are physically feeling good. And these people are chiropractors, massage therapists, and pelvic floor physical therapists. I have done all of the above and would say, in my opinion, physical therapy is the long game. It's a preventative option that is highly effective when you stick with it, little by little, constantly preparing yourself for birth and just strengthening your body and overall, having good body mechanics. So starting early is ideal if you can. And then chiropractic care and massage therapy, in my experience, have been amazing ways to maintain wellness and also help my own self if I have flare-ups of certain aches and pains, and helping kind of get past those things so that I can continue to maintain my, physical therapy exercises. If you follow me on Instagram, I had a pinched nerve on my right side for about a week, and it was really awful. And then one day, something in my right side of my hip or butt area, I guess piriformis is the more technical muscle that was specifically affected, but something happened and I couldn't walk. I couldn't do anything at all. It just super flared up. I was crippled on the floor, crawling around, trying to figure out how the heck I was supposed to care for my 2 other kids. And my husband was at work, kind of on standby, seeing if he had to come home. And a few hours later, it loosened up a little bit for me to actually function, but I was still, 10 out of 10 pain, and I didn't know how to come down from that. I reached out to a friend who had a prenatal massage therapist recommendation in the area, and she happened to have an opening that afternoon, right when my husband came home from work. And I was actually able to drive myself, which I hadn't been able to drive really the day before because I was in so much pain. But she did a few releases and pressure points, and overall, working out those knots in a few areas helped me feel 1000% better. And honestly, since then, I have seen her another time. I have not had any pinching or nerve pain since, and I've been able to do some of my more gentle stretches and exercises to maintain where I was at. I've been using a maternity support belt to help with compression of my hips, to help my SI joint. So there's so much stuff that you can do to prepare your body and to make yourself feel good and be able to do these exercises that will hopefully strengthen your body and prepare you for labor as well. So not necessarily an induction method, but also, not having those high levels of cortisol and stress. And my blood pressure was probably high, being in so much pain. So definitely something I recommend to just really try to maintain a healthy body and be able to physically function well and do the things that are then going to be able to help you progress your labor along. Treatments like chiropractic care and massage are a great way to release tension in the body. And like I said, they won't induce labor on their own, but they hopefully can make you feel the best that you can in your pregnancy to then encourage labor to begin when your body is ready. And hopefully when it does begin, it makes that process a little bit more comfortable and more efficient. Acupuncture is also something that I didn't mention with that list, but it's something that can promote labor by stimulating specific points on your body. And I don't have personal experience or professional experience with recommending this, but again, something that you can try for similar reasons as chiropractic or massage or physical therapy. The next few things that are the most common ones that women talk about are, the first thing is sitting on a birth ball, which is, the same thing as an exercise ball. And I literally mean sit and sway back and forth, side to side, in circles, figure eights, those big exaggerated motions of the hips, maybe even little circles. All of these things can relieve some pelvic pain or back pain if you may have that, and also help baby get into a good position for labor. It is also really easy to do if you are working on your computer at a desk or watching TV. It's something that's easy and just definitely worth trying. What you should not do is bounce on the birth ball. This is not recommended due to the stress that it puts on your pelvic floor. So not recommended to bounce on the birth ball, but doing those other things that I mentioned. Red raspberry leaf tea is something women often drink as well, and eating dates near the end of their pregnancy around 34 or 36 weeks. Red raspberry leaf tea is beneficial to help tone the uterus, which is a muscle, and help make those contractions in labor stronger and more efficient at birthing your baby. So there is a potential that your labor could be shorter if you drink 1 to 2 cups per day in the 3rd trimester. Dates can also help your cervix soften in pregnancy, which helps it become easier to dilate when labor does actually begin. Your cervix starts out really thick and firm, which is hard to dilate, and this is good that your body does this to keep your baby inside of you until you are full term. As you get further along in your pregnancy, and also with the help of dates, your cervix can begin to soften, prepare for labor, and then allow for dilation to happen more quickly and more smoothly for you. So again, another potential for maybe a shorter labor. And then talking about softening the cervix, another interesting thing that is proven is that semen contains prostaglandins, which help soften the cervix. And orgasm can stimulate your uterine contractions as well. So sexual activity, if you're up for it, can be another way to help get your body into labor. Also, practicing mindfulness techniques, diaphragmatic breathing, meditation, and overall training your mind and connecting your brain with your body to have control over how you react during labor can definitely be helpful. And this one for me is very difficult. We're still working on it, but it's something that is a great tool to have if you're planning an unmedicated birth, or if, I think it's always great, even if you are not planning an unmedicated birth, to have extra tools in your pocket until maybe you request the epidural, or maybe if the epidural unfortunately doesn't work, it's always great to have these alternative options to lean back on that you've practiced. The calmness and reduced stress can also help you go into labor when your body is ready, because you don't have that mental block and are accepting and overall surrendering to the birth process. Things like this are really simple and often overlooked, but are so important of the birth preparation process. And I just wanted to mention one app that I like to practice mindfulness with is called Insight Timer. So if you're interested in downloading that free app, it's called Insight Timer. There is also evening primrose oil that some studies show can help ripen the cervix if inserted vaginally 2 times per day, where others say it has no effect on cervical ripening or labor. Reviews have shown it may shorten the pushing stage, where other research suggests that it can lead to a longer and slower labor. There are also side effects, including nausea, headache, diarrhea, and if you're taking an anticoagulant, it should not be used due to the risk of bleeding. So maybe something to consider and chat with your provider about, if it's appropriate to use in your situation, but there isn't also that much data to back it up that it's super useful. Castor oil is also something that comes up when women talk about inducing labor, and this is a strong laxative and can cause nausea, diarrhea, cramping, dehydration, low blood pressure, and dizziness. Research does show that it can be effective about 50% of the time, leading women to beginning their labor within 24 hours of having taken the castor oil, but it also may increase the risk of baby pooping in utero before birth, which can cause other complications in itself. And overall, not something that really sounds like that great of an idea, but of course, every situation is unique. So that is every individual person's choice in their situation, because I have seen it also be a really useful tool for moms that are not comfortable going past a certain number of weeks of pregnancy, and they are okay with that nausea, diarrhea, cramping feeling. But to labor with severe GI upset and diarrhea does sound really challenging. So if it can be avoided, maybe not going with this option, but it's also a tool there to keep in mind that I wanted people to know about. And then a couple other things that you can try that some people swear work, but there also really isn't much information out there to prove whether they actually do or not. But if you're at this point in pregnancy that you want to be done, maybe it's worth a shot. So these things are eating eggplant parmesan, spicy foods, and pineapple are potential options. Also, nipple stimulation with your fingers or a breast pump can also be something to stimulate contractions and that oxytocin production to maybe kickstart labor. There are many possible methods, and trying what you want can maybe help your labor progress, but it also isn't something that is required to have a spontaneous vaginal delivery either. If it stresses you out, then absolutely forget about it. Some of these methods are not suitable for moms at risk for preterm labor, and is why many are recommended after you are full term at 37 weeks. So definitely checking in with your provider and doing your own research is important too. Thank you so much for tuning in to Your Birth Bestie podcast today. Please remember that pregnancy is an amazing experience and your body is perfectly designed to know when it's time for your baby to arrive. It's important to trust in the natural process of labor, and I don't want that message to be lost at all when suggesting a few things to support labor onset. So the main takeaways would be that your body's timing is perfect, every pregnancy is unique, and your body knows the optimal time for your baby to be born. Prioritize a stress-free environment. Stress can inhibit labor, so relaxing and letting nature take over can promote a smoother, more comfortable labor. And then focus on maximizing your confidence. Trusting your body boosts your confidence and reduces anxiety, which is great for both you and for your baby. This is why taking advantage too of my discounted Fearless Birth Academy course for only $99 would be such a great tool for you as you are focusing on informed consent and birth autonomy to really feel calm and confident going into your labor and delivery. I can't wait to see you in there. Thank you again for joining me today. And if you do decide to try encouraging labor naturally, please do so gently and with the guidance of your healthcare provider. I will be here next Tuesday with another episode. Bye, everyone.